All right, folks, it's 10:30, so I'm going to go ahead and get started because we have a lot to cover. Thanks for being here. My name is Jen. I'm one of the program coordinators at Crisis Support Services on our education team, and I'm joined by my colleague, Mercedes, who's going to be supporting the workshop today. And today we're going to be talking about suicide safety planning. This is going to be an introduction. We're going to learn about what safety plans are, how do we use them, and then we'll get a chance to practice together how we can support someone in developing a safety plan. I do want to acknowledge that sometimes suicide can be a tough thing to talk about. So if at any point during this presentation, you feel like you need to take a break, take a step back, please feel free to do so. Do what you need to do to take care of yourselves. So with that, let's go ahead and get started. These are our learning objectives. So like I said, we're going to talk about what is a safety plan, how do we use them, and then we're going to get that chance to practice how we might help someone develop the safety plan. So let's get right into that first piece of like, what even is a safety plan? These are evidence-based emergency plans. They act as a brief intervention, and they're different from suicide contracts, which you might have heard of, which are contracts where a person signs a contract saying that they're not going to hurt themselves. These are different because a safety plan has tangible tools, tangible things that a person can do during a crisis to help reduce that suicide risk. So we have a person write down what their coping strategies are, who their support network is. And the idea behind it is when a person starts to notice their warning signs of a crisis, they turn to their safety plan and they use these distraction techniques to distract from those intense urges. And it's just one spoke in the wheel. So what that means is that suicide safety plans shouldn't be used by themselves. They should be used along with other interventions to help support a person's wellness. So why do we even use them? Well, it turns out they're actually quite effective. So research has shown us that people who use safety plans have a 45% decrease in suicidal behavior. And because of that, it's actually considered a best practice. And like I said, it uses distraction techniques. It leans on a person's support networks to help support them through a crisis. Because what we know about a crisis is that they're often time limited. So what that means is that it has a start and an end point. And if a person can be prompted to use their safety plan to distract from these suicidal urges, we can get them to that end point more safely. And the other thing that's really helpful about them is because you remember we said that they're a written down plan. When a person is really stressed or they're distressed or they're in crisis and that fight or flight system is activated, it can be really, really hard to remember what our coping strategies are. So when it's written down, a person doesn't have to think about it, they can just act. The safety plans that we're going to be talking about are evidence-based for ages 12 and up. They are currently in the process of developing safety plans for folks who are younger than the age of 12. I'm not sure when they'll be ready to go yet. That doesn't mean that you can't use these safety plans for younger folks. It just means that they haven't done as much research on the effectiveness. But let's kind of take a look at how do we use them. So think about safety plans like if-then statements. So if I notice these symptoms of a crisis, then these are the steps I'm going to take to distract myself from the crisis. And it moves from the self, so things that a person can do on their own to distract from a crisis, and then moves into identifying who are my support networks, what are my resources in the community. And sometimes a person has to use the steps more than once. And the whole goal behind using a safety plan is that when the person starts to notice those first signs and symptoms of a crisis, they use their safety plan to prevent that crisis from escalating. So we want to prevent that person from going towards the red and start moving them down towards that green. And so let's take a look at a safety plan template. There are a lot of different templates out there. This one is the one from Stanley and Brown, and it's the one that we're going to be using for the rest of this presentation. And we're going to take a moment in the next slides to break down each section. But I wanted to share a couple of tips before we get into that. When developing a safety plan, it's helpful to do it during a period of wellness, because sometimes it's easier for folks to think about their coping strategies, think about folks they can reach out to, and also think about those things that give them hope when they're in that period of wellness. It's a living document. So what that means is the things that you put on a safety plan, it's not set in stone. It's okay to revisit them, to ask a person like, how is this working for you? Are there things that maybe you want to change? So it's okay to update safety plans. The other thing that's really helpful to do is have the person put it in their own handwriting, or at the very least in their own words. And the reason we want to do that is because it provides this sense of ownership over the safety plan, and it's going to increase the likelihood that this person is actually going to use it. We want to make sure it's feasible and accessible. So what that means is whatever a person puts on their safety plan, we want to make sure it's things that they're actually going to do. So as an example, if a person is not already really into jogging as a way to cope, we don't want to put that on our safety plan. We want to use things that are tried and true, things that a person knows works for them and helps them cope with a crisis. So we don't want to try new things on the safety plan, because one, person's less likely to do it, and two, if it doesn't work, it's going to increase those symptoms of distress. We're going to talk a lot about specificity during our example. So we'll see what that means. But essentially, it's making it so a person doesn't have to think about what they're doing. We want to try to make it as specific as possible, so this person just has to act. We want to keep multiple copies in easily accessible locations, and we're really following the patient's lead, because this person is going to be the expert in what's going to work for them, what coping tools are helpful to them, what people they like to reach out to for support. Our role in helping someone is really just going to be to ask them questions to guide them in developing their safety plan. That said, sometimes it's helpful to have some things in the back of our mind just in case a person gets stuck and they don't know what to put down on their safety plan. And lastly, with cultural considerations, what that means is think about a person's culture. Maybe they don't speak English, so using a template in another language might be more helpful. Sometimes you don't even have to use a template. Maybe a person just wants to write it down and put it, color coded. Also, it could be in like the notes section of a person's phone, so you don't have to necessarily have it on the template. And so let's take a look at each of these sections. Step one of the safety plan are warning signs. So this is like, how is a person going to know when they should use their safety plan? What are some things that they feel? What are some things that they experience, thoughts that they have, images maybe that they experience when the crisis occurs? In step two, this is where we're getting into those internal coping strategies. So these are things that a person can do when they're by themselves to distract from the crisis. And it really starts to build that self-efficacy, because when a person can see that, like, hey, I have things that I can do to make it through this crisis by myself, it starts to build that self-confidence, and it starts to even build a person's ability to see hope for the future as well. Step three, people in social settings that can provide distraction from a crisis. So these are people and places that are positive influences on a person's life and who they don't have to disclose their crisis to. So these are people who they can kind of just hang out with, really lean into that socialization as a way of finding connection and community. And they don't have to tell this person that I'm experiencing a crisis. And then that's different from step four, which is people who I can ask for help. And these are people who do know about the crisis and can maybe physically be with the person or can connect them to additional resources. Then we move on to step five, which are professional agencies for support. So these could be a person's medical or mental health providers, emergency rooms, crisis line phone numbers. Some folks maybe prefer to use non-traditional Western medicine resources. So this could also be like faith healers, spiritual leaders as well. So again, depending on a person's cultural preferences, step 5 could look a little bit different for everyone. In addition, when we think about culture as well, crisis lines, there's different crisis lines available for specific communities, and we'll talk about that in our example. Step 6 is how are we going to make the environment safe just during that period of crisis? And we really want to have folks with a detailed plan where each person has an assigned role in how we're going to make the home environment safe for this person. And then the last step is step 7, which is something worth living for, something that gives a person hope for the future. And I know sometimes this one can be a little bit challenging because sometimes people do feel this sense of hopelessness, but you'll notice that it's step 7. So it's actually the last one that we talk about. And it's like that by design, because the hope is that as a person is filling out their safety plan and they're seeing that I do have coping strategies, I do have people I can reach out to, I do have these support networks in my community, it might make it a little bit easier for them to engage in this conversation about what's worth living for, what's that thing that gives me hope. And so with that, I want to give us an opportunity to actually practice. How do we help someone develop a safety plan? And I do see in the chat, there is a question, is a paper version better than a safety plan app? You can use either one. Depends on the preference of the person. So some folks might prefer to use the paper version. That's totally okay. Some folks might prefer to use the safety plan. That's also totally okay. So really follow the lead of the person that you're helping as to what's going to work best for them. All right, folks, so let's take the rest of our time together to practice. And we're going to have a scenario that we're going to work through together, and we're going to be meeting our client, Jane. And while I know that many of you have different roles in this room, today what I'd like you to do is imagine that you are a peer counselor and you're seeing your client, Jane. And she mentions that she's been feeling really low lately. Some days she feels like she just can't get out of bed to go to work. And she mentions that she's had trouble sleeping, she's irritable towards her partner, and some days she wishes she could just disappear. When you hear this, you're concerned that Jane might be having thoughts of suicide. And so you say, sounds like you're feeling really overwhelmed and I'm worried about your safety. When you say you wish you could disappear, does that mean that you're having thoughts of suicide? And Jane lets you know that she has had these thoughts, but currently she has no plans to act on her thoughts of suicide. So you decide you're going to connect her to those outpatient resources and also develop a safety plan. So let's take a look at each section of the safety plan and how we're going to help Jane develop it. So we're going to start with step 1, which is the warning signs. And you'll notice throughout these different steps, you're going to see text in blue that's italicized. That is language that you can use, questions that you can ask when you're helping someone develop a safety plan. So with step 1, remember, this is how Jane is going to know when to use her safety plan. So we're going to ask her, what are some things that you experience before a crisis occurs? How are you going to know that it's time to use your safety plan? And so Jane does a brainstorm. She tells you she experiences depression. Sometimes she feels like a burden. She has low appetite. She notices she cancels plans with loved ones. She has trouble sleeping. And she has suicidal thoughts. And so that's a really robust list of warning signs. But what we really want to tease out is which of these are specific to a crisis. Because maybe Jane experiences depression many days of the week, but she doesn't necessarily need to use her safety plan because she's not necessarily in crisis. Maybe Jane, sometimes she gets stressed like before a job interview or a big life event. And she also experiences decreased appetite and trouble sleeping during those times as well. And so those might not be specific enough to a crisis. So what we can ask Jane is, of these warning signs, do they all happen just during a crisis, or do you notice them other times as well? If she says just during a crisis, then that's great. That's specific to put on the safety plan. The other way you can help tease this out is by asking, think about the last time you had a crisis. What happened right before? What were the things that you experienced? What did you feel right before that happened? So of these, the ones that Jane reports she experiences only during a crisis is feeling like a burden, canceling plans with loved ones, and suicidal thoughts. And so those are the ones that we would have Jane put down on step 1 of her template. And remember, the if-then statement. So if Jane starts to experience suicidal thoughts, canceling plans with loved ones, and getting easily frustrated, then she's going to move on to step 2, which is internal coping strategies. So remember, these are things Jane can do by herself when she's starting to experience a crisis. And so the question that you ask her is, when you start to feel this way, when you start to notice that you're getting overwhelmed, that you're canceling these plans, that these thoughts of suicide are happening, what helps you feel better? When things get really tough, what do you do to take your mind off of things? And so Jane responds, she likes to listen to music, she watches TV, she sometimes talks to a sibling, she does breathing exercises, and she likes to play basketball with a friend. So of these things that Jane has brainstormed, what is standing out to folks as internal coping strategies? So go ahead and put that in the chat. What stands out to you as those internal coping strategies? Mm-hmm. The breathing exercise is standing out. Yeah. What else? Mm-hmm. Yeah, lots of folks picking up on the breathing exercise. Listening to music. Yeah. Anything else that folks are noticing? Mm-hmm. Walking in nature. Yeah, that could be an additional one. Yeah, they could all be good for Jane if they work. Watching TV. Yeah, so remember here with internal coping strategies, we're thinking about things that Jane can do by herself. So nice job, folks. We picked up on these 3, which are solo activities. So she's going to listen to music, she's going to watch TV, and she's going to do a breathing exercise. But do these feel specific? Because remember, we want to try to help Jane take the guesswork out of it. We don't want her to have to think about what she's going to do. We want her just to be able to act and use these coping strategies to distract from the crisis. So what are some other questions you might ask her to help make this more specific? Mm-hmm. What music do you like to listen to? Yeah, which TV show do you like to watch? What else? Mm-hmm. Which friend? Yeah. What breathing exercise do you like to do? Mm-hmm. Have you tried a breathing exercise before? Yeah. So we want to make sure that these are those tried and true coping strategies. So we want to make sure that Jane has tried breathing exercises and knows that they work for her. Nice job, folks. Yeah, which of these truly help to switch gears? Yeah. Which friend is most helpful in their responses and which realistically don't help? Yeah, those are super important questions. And I'm actually going to come back to those for our next step, which is going to be people in social settings that we can use for distraction, because we'll talk more about reaching out to friends. And so with step 2, we're focusing on those things that Jane can do by herself. And a lot of the questions that folks have put in the chat are how we're going to help Jane make it more specific. So we talked about, what music are you going to listen to? Jane says she's going to listen to her pop music playlist, so the specific type of music. And where are you going to find that playlist? So she's going to listen to it on Apple Music. With the breathing exercise, the specific type of exercise she's going to do is called square breathing, and she's going to try that for 10 minutes. And then the TV show. The TV show she's going to watch is Friends, and she's going to find it on Netflix. We could have made it even more specific by having Jane write down which episode she's going to watch or which seasons of Friends she's going to watch. One thing to be mindful of is accessibility. So the first 2 on this list might be accessible from anywhere, but maybe number 3, watching a TV show, might only be accessible when Jane is at work, might not be accessible when Jane is at work. So we want to be mindful that when we help someone create the safety plan for step 2, we're putting things on there that are also accessible from anywhere, in addition to those things that, maybe she can only do at home or at work and so forth. So let's go ahead and take a look at before we go on to step 3, an additional thing that you could include in here is a picture of the square breathing. So that way Jane doesn't even have to think about, like, how do I do that square breathing? She has the diagram as well. So you could have this attached to her safety plan as well. And so that brings us to step 3, which are people in social settings that can provide distraction. So these are people in places that have a positive influence on Jane's life, and we're really using socializing as a way to create this sense of belonging and connection. And again, these are people that Jane does not have to disclose her crisis to. And so you ask her, what are places you like to go to take your mind off of things? Who are people that you just really like to hang out with, who, bring you joy, who make you feel good? And so Jane's brainstorm leads to coming up with the library. She likes to go to Starbucks. She likes to hang out with her former college roommate, and she likes to spend time with her friend, John Smith. So again, let's use the chat feature for this. What are some questions that you can ask Jane to help make this more specific? Yeah, the time of day each of them are available. Yeah, that's a really helpful question. Yeah, what do you like to do at the library? So when you get there, what are you going to do? Yeah, if these places are closed, what can you do? Yeah, which Starbucks are you going to go to and why that one? Yeah. What else? An additional question we could ask is, what are you going to get at Starbucks? What's your favorite order? Yeah, what's your favorite Starbucks drink? Thank you. Yeah, how do you know John? Absolutely. Nice job, folks. So let's take a look at how Jane makes this more specific. Yeah, if John or the roommate aren't available, is there anyone else you feel comfortable hanging out with? Yeah, that's a really helpful question, because you'll notice on these safety plan templates, there's only space for 2 people. but we can add additional folks as well. So, you could have a separate piece of paper, you could write it on the back as well, of having these other folks that she feels comfortable spending time with. So the way that Jane is going to make this more specific is she's going to go for a meal at her favorite restaurant with her roommate. An additional thing that we could have also included on here is like, when is the roommate available? Is she only available on the weekends or in the evenings? With her friend John, she's going to talk to him on the phone, and she's going to ask him about books because she knows he really likes to read. And so that way, if Jane feels stuck, she doesn't even have to think about a topic she's going to speak to John about. She already knows that she's going to talk to him about books. With the library, we want to identify, where is it? What are the hours of operation? Maybe even how is she going to get there? And what is she going to do there? So we could have included that on our safety plan as well to make it even more specific. And then with Starbucks, again, where is it located? The hours of operation. And we could have also included what her order is going to be from Starbucks. So again, we're trying to take the guesswork out of it and just allow Jane to act and do the things that feel good for her. And so that brings us to step 4, which are people who I can ask for help. So remember, these are folks who she can disclose her crisis to, who can maybe physically be there with her, who can connect her to additional support. And so the questions that we're going to ask are like, who do you reach out to for support? Who do you trust? Who do you feel comfortable talking to during a crisis? And so Jane responds with her parent, her partner, and her coworker. And we see, to make this more specific, Jane puts down when these folks are available. So her mom and her partner are available 24/7, but Mary from work is only available during those work hours. And so it's helpful to let Jane know that she should check in with these folks to tell them that they're part of her safety plan, and that way they can also be prepared to offer her support should she need it. And so that brings us to step 5, which is professionals or agencies that a person can reach out to for support. So we want to know, who's Jane already connected with, and who would she like to be connected with? So we can ask, who do you feel comfortable with? Have you ever heard of a crisis line? This could be a good time to try it out together. So for folks who have never called a crisis line before, it's okay to call just to try it out. And sometimes people are afraid to reach out to a crisis line. So if you're helping them create a safety plan, call together, because sometimes it feels safer. And you can say to them like, hey, why don't we just test it out, see what it's like? And when they do that with someone that they trust, that they feel comfortable with, it can make them feel a little more comfortable reaching out to the crisis line on their own. So Jane has her list of providers. I also want to acknowledge, not everyone has access to care. Not everyone wants to use traditional medical resources. And so this is a place where, one, we can brainstorm if there are cultural practices or faith healers, spiritual leaders that we can use as resources, but at the very least, include the phone number of an emergency department, and like I said, the crisis hotline as well. And so we're gonna take the information from Jane's brainstorm and put it on step 5. Again, we're putting the name of those clinicians, their phone numbers, their hours of operation as well, where they're located. On these safety plan templates, you'll notice that they already have the phone number of the Suicide Lifeline typed on there. The 8255 number that you see there, that still works. It's actually the old number. It's now 988. And I have checked, they haven't updated their templates. So if you are using these templates, I would encourage you to let folks know that 988 is the new phone number. It's just a little bit easier to remember. And it's also helpful to have them just plug it into their cell phone. That way they have it on hand whenever they need it. And so I want to take a moment to briefly talk about crisis hotlines. For those of you who are here in Alameda County, we are your local crisis hotline. There are two ways to access us. One is by calling our direct line, which is that 2131 number, or you can reach us by calling 988. 988, it's a national number, so it works based on your area codes, and you get routed to your local crisis line based on your phone number. So if anyone calls 988 and they have a 510 number, a 925 number, or a 341 number, they're automatically going to connect to us because, again, we're Alameda County's local crisis line. But if you know someone who's recently moved to the area, who has an out-of-county phone number, I would recommend giving them our direct line. That way we know that they can be connected to us and to our local resources. One thing that I want to share about crisis lines is that a person does not need to be suicidal or in crisis to call. If someone is having a really bad day and they just need someone to talk to, it's okay for them to reach out and talk to someone on the crisis line as well. For Alameda County, we also offer a text line. Our services for texting are available from 8 a.m. until midnight every day in English. And then in Spanish, we're available from 5 to 9 p.m. on Tuesdays through Fridays. You can also text with 988, and that is available 24/7 in English and Spanish. And then, as I mentioned earlier, there are specific hotlines for certain communities. Through 988, a person can access the Spanish hotline and the Veterans hotline. There's also two hotlines available for members of the LGBTQ+ community. And then there's also a hotline for older adults as well. And these are all specific for suicide. So you'll be getting a copy of these handouts. Don't worry if you haven't had a chance to write everything down. But I just wanted to let you all know that there are these additional hotlines that a person might want to include on their safety plan. And so that's going to bring us to step 6, which is about making the environment safe. And when we get to this step, one of the questions we want to ask Jane is, have you thought about how you would end your life? Because we want to know if she has a plan. We want to know when, where, and how. And if we can remove the how from her environment. Because like I said in the beginning, what we know about a crisis is that it has a start and an end point. And if we can physically remove the means for suicide, that gives us time and space to work. So, it gives time for Jane to remember to use her safety plan or to reach out to the crisis line. And that way we can get to that end point more safely. And so we hear from Jane that she hasn't really thought about how she would end her life, but maybe an overdose, but she does have access to a firearm through her partner. And so how are we going to collaborate to make the environment safe? One thing that's helpful is to make sure that folks have assigned roles in what they're going to do to make the environment safe. And one of the questions we can even ask Jane is like, what would make you feel safe at home? And so her brainstorm, Jane says that she's going to collaborate with her partner to remove the firearm. So Jane's plan is to physically get it out of her home environment, and we're going to store it at a trusted relative's house during the crisis. And we emphasize during the crisis, especially with firearms, because folks have firearms for a lot of different reasons. Maybe they work in law enforcement, or it's for protection, or whatever it is. So we want to emphasize that we're not asking you to remove it forever. It's just to keep this person safe during the crisis. And when you come at it from this place of safety, folks are often more willing to engage in this conversation. With the medication, Jane's mom is going to keep it at her house, and she's going to come over to dispense. I know this conversation about making the environment safe it's a really big one, one that we don't unfortunately have time to get into too deeply in this training, but I do want to let you all know that there is another free training available called CALM, which stands to Counseling Around Access to Lethal Means. And that is, again, a free training where you can learn more about how to have these conversations. There's also video vignettes, so you can see folks interacting, and you can get that language around this conversation as well. So that's going to bring us to our final step, which is reasons for living. So something that gives Jane hope, something that keeps her going. And the questions we ask are, when you have these thoughts of suicide, what stops you from acting on those thoughts? What keeps you going? What's something that gives you hope? So Jane's brainstorm, she says the things that keep her going are her dog and wanting to earn her degree. For some folks, that thing that keeps them going might be far off into the future. So something like wanting to earn a degree or maybe owning a house. For other folks, sometimes it's more helpful to think not as far in the future. So someone might say the thing that's keeping me going is like my favorite holiday is Halloween. And so that's the thing that I'm living for. And remember, safety plans are living documents. So once that event has passed, we can revisit and say like, okay, I know Halloween's over, but what's that next thing that's keeping you going? So it doesn't always have to be something that's super far into the future. It can be something that's more immediate in time. We talked about getting creative. So in addition to writing it down on here, maybe we include a picture of Jane's dog and attach it to her safety plan as well. I know sometimes this can be a challenging one, but do your best to at least have a person write one thing down that gives them hope. And so that is the last step of our safety plan. And so I wanted to share just some final thoughts with you all. These are our key takeaways of this workshop. Safety plans use distractibility, and they should also not be used by themselves. So we want to make sure that folks are connected to other interventions as well, other supports as well. It's just, remember, one spoke in that wheel. Again, it should be feasible. So things that a person knows works for them, things that they can actually do to help them distract from that crisis, to help them feel better. Remember, collaborate. So we don't have to necessarily have the answers. We just ask the questions because that person is going to be the expert in knowing what works best for them. If a person's using a paper template, keep multiple copies. Ask them, like, where are you going to keep it? Do you think there might be anything that prevents you from using it? And if yes, talk about like, what are some ways that we can overcome those barriers so that you can be successful in using this safety plan. You probably heard me say it 1,000 times today, but one last time, do your best to make them specific, because remember, we're trying to take the guesswork out of it. We're trying to just allow the person to act, to do the things that are going to make them feel good, that are going to help them reduce that distress that they're experiencing. And then lastly, if you're working with a young person, if possible, try to have a trusted adult present who can be there as you're developing it, or at the very least, after you've developed it, tell them how it works so that they can be prepared to support that young person in using their safety plan. All right, folks, that's all I have for you today. I know that was a lot of information and it came at you quite quickly, but I'm happy to take questions if folks have any.
I have a question. Can you hear me okay?
Yep.
Thank you so much. This was really, really helpful. Can you talk a little bit about verbal contracts? I saw that you don't have that in this safety plan.
Yeah, so are you talking about the contracts for safety?
Yeah, so, are you, do you feel safe? Are you not going to harm yourself in the next 24 hours or something like that?
Yeah, so um in the literature, there's not a lot of evidence that supports contracts for safety as being effective. So they are different from safety plans.
Okay.
And what folks are encouraging the use of more is safety plans, because the way that they're different from contracts for safety is that they provide like those tangible things that a person can actually do when they're in crisis to reduce that distress. Whereas like with a safety contract, it's just that they sign a piece of paper saying that they're not going to hurt themselves, but they're still experiencing this distress. And so that's why we're really encouraging folks to lean into safety plans, because it provides them those coping skills, the things that they can actually try to reduce that sense of distress.
And do you think that because I've been using both with a friend, and it kind of allowed me, the verbal contract allowed me to hear, because usually she was like, okay, I can keep, I promise I can keep myself safe for 24 hours.
Mhm.
And then at one point she's like, no, I can't promise that, so then because since she was being honest, then I kind of knew what the different, how urgent that
Yeah,
situation was versus,
yeah. Yeah, and that's really helpful that she is able to have that awareness of like, I can't make this promise,
yeah,
because then that implies that there's a lot of trust there. And
yeah.
also, she's reaching out for help and asking for help. So that's um really helpful to hear that she has that awareness and she can ask for the help.
Yeah, the other question I have is, and this may be an offline thing, but after someone is on a hold, is there any suggestions you have for the safety plan, or is it the same safety plan you would go through?
Yeah, so after a person's been, you mean released from like a 5150 hold?
Yes, yes.
Yeah, you can use the same templates.
Okay, so there's nothing different you would do after 5150.
Yeah, I mean, yeah, having those conversations about immediate safety. So again, asking a person like, if you don't feel safe, do you think you could let me know? So just kind of having maybe additional supports, because we know that can be a particularly vulnerable time after a person's been released from
Right,
the
that's what I'm
hospital.
concerned about. Yeah, that it could
So
be even worse, right?
yeah, so definitely the safety plan templates that we've talked about you can use, but maybe having an additional conversation of like, if you feel unsafe, um, do you think you could maybe call a crisis line, or do you think you could reach out to me or whoever it is that's part of their safety network? So I would say like still use the templates, but you
Yeah.
can also have just additional conversations around like, if you start to feel unsafe again,
Uh-huh.
what can we do to keep you safe?
Okay. And what was the name of the safety plan you're using?
This is a Stanley and Brown.
Okay, thank you. And
Yeah.
is that on the Alameda County crisis website?
Um, I'm not sure if it's on our website, but I think if you just Google
Okay.
Stanley and Brown, you'll be able to come it'll pop up.
Okay. Yeah, I've been calling the crisis line every day this week to support a friend. So it's been really helpful. And I just a suggestion if you wanted to put that crisis plan on the website so the counselors can refer to it, because that would be really helpful.
Cool. Yeah, thanks for that feedback. I'll definitely share that. And I also noticed that Mercedes shared a link called handouts. In
Oh,
that
great.
handouts link, there's templates. The Stanley and Brown template, but also templates in other languages and some other helpful materials as well. I
Thank
also
you so
see the
much.
chat. Yeah, of course. Is there a way to look up your local crisis hotline if you've moved out of the Bay Area? So one thing you can do is call 988, and they can let you know, but you can also like Google your area. So if you're in like LA, you can just type in like LA County Crisis Center as well. And I see Ben also dropped the link for the Lifeline network as well. So that's another place that you can look up your local crisis hotline number. Thanks, Ben. Any other questions, folks? We have a couple more minutes left together.
I'm also going to place in chat the number to access our hospital follow-up program as well. So for anyone that has just left the hospital, our CSS has a hospital follow-up program. So I'll place the number on chat.
Thanks, Mercedes.
This might be a little, well, I don't know. It's more in the alternative realm. I was asking my acupuncturist about treatment for, or like different protocol for depression. Is there any thing in the literature that you've seen about acupuncture with helping with this?
Yeah, I mean, I know some folks definitely use that as a part of like their treatment as well. So it really depends on like what works for a person and, finding the right combination of, things like acupuncture, professional support, their social network. So yeah, it really depends on the person and kind of what works for them.
And I guess another question is, so you have the people in social settings that can provide distraction. Do you have any recommendations about talking about people that you should stay away from during this time?
Yeah, so that's a good question. So we really want to encourage people in places that are a positive influence on this person's life. And so, for some people, maybe a social setting that they find distraction from is like a bar, but being around alcohol and substances might not be the most helpful thing during a crisis. And so we do want to really encourage, like, lean into that positive social setting. So if someone says that, ask like, well, what about an AA meeting? Would that be something that would be helpful? For some people, it might be like going to maybe a place of faith, like a church as well. So yeah, we do kind of want to focus on like the positive influence on a person's life.
The last question I think is, do you have, it seems like, nighttime can be very triggering. Besides the hotlines, I don't know, do you have any other suggestions for, that early morning, nighttime kind of time of what to do, especially when someone's like ruminating and, it's just like hard to get out of those thoughts.
Totally. Yeah. So one thing would be to find out first when a person's like social network. So in our example, we had Jane's partner who was available 24/7. So one would be find out if there are people that she can reach out to at night.
Okay.
But the crisis line is something that is available 24/7. And so that is one of those
other things.
Yeah, that's definitely one of those helpful resources that is available in the middle of the night. And there are folks who are highly trained in crisis de-escalation answering those calls. So I think this is a good time to practice calling the crisis line with whoever you're helping, because like I said, sometimes it's intimidating to reach out. And so if there's that increasing comfort in reaching out to the crisis line, I think that can be a really helpful resource for someone who's having those thoughts, especially in the middle of the night. Because like I said, this is what our counselors do. This is their area of expertise, and they're really great at supporting folks who are experiencing a crisis.
Okay, thank you.
Yeah. All right, folks, I see that we're just about at time. I want to thank you all for being here. And I know Mercedes has dropped a couple links in the chat. So there's the handouts again, and also an evaluation. So we'd appreciate you all taking a couple of minutes and filling that out. But yes, I again just want to appreciate you all for being here and spending your morning with me. And I hope you enjoy the rest of the conference. And have a good rest of your day, folks.